Hello everyone, this is Dr. Saritha Reddy, consultant pediatrician from Ankura Hospital, Attapur branch. Today I would be talking on the common childhood injuries and the safety measures that the parents have to take. So in our office practice, we come across various childhood injuries. The most common is the fall. Children tend to fall from the beds, they tend to fall from the staircases, elevators, and some of them have severe injuries because of the fall from the first floor or the second floor. They can sustain injuries while riding the bicycle, or from the toddlers they can fall from the walkers, and some of the accidents can happen because of the road traffic accidents. So parents should ensure that whenever the child is on the bed, they have to keep the safety strains so that the child doesn't fall, and there should be a constant supervision of the children. Whenever they are climbing the stairs, the parents should hold the hands, and safety measures should be taken. The second most injuries that we see are the burns. Children tend to sustain burns because of the hot fluids or the liquids such as the hot coffee or the tea. And next most common thing is because of the hot water kept for the bath, and sometimes they can sustain injuries because of the steam inhalation, and children are prone to play with the matchboxes and the crackers. These can also cause severe injuries, severe burns, and we have seen most of the electrical burns because of the unsafety electric sockets. And especially during the kite festival, we see that the children tend to play kites without the adult supervision, because of which they are sustain severe electric burns because of the high tension wires. So always the parents should ensure that there should be a constant supervision of their children, and never drink hot coffee or the tea while holding the children, and always check the temperature of the water whenever you are giving the bath to your children. The third most common is the poisoning thing. Poisoning can happen because of the medicines or because of the laundry products. Children tend to ingest the kerosene, turpentine oil. Sometimes they come with the all-out poisoning, camphor poisoning, naphthalene balls. So adults should always keep these medications out of reach of the children. They should never store kerosenes or the turpentine oil in the food containers or the water bottles, and never make the medicine as a candy, because this can lead to the overdosing. And the next most thing is the foreign body ingestion. The children tend to keep the foreign bodies in their mouth or the nose, such as they ingest the coins, batteries, pins, safety pins, buttons, sometimes beads, grapes. So these foreign bodies, they can enter either through the windpipe or the foot pipe. Whenever they enter the air pipe, they tend to choke. Parents should learn some of the maneuvers like the helmet maneuver, so that and also the CPR technique, so that at least they can save their child before the arrival to the hospital. And the other most common injury that we see is the drowning. Small children, they tend to drown in the buckets filled with water and swimming pools, backyard pools. So parents should ensure that they should not leave the children near the water filled with the bucket, and they should always supervise the children whenever they are near the swimming pools. And the safety guards should be used. They should learn the CPR techniques. So taking these simple measures, parents can prevent the serious injuries and unnecessary hospitalizations. Because children are very active, they tend to sustain these injuries in a fraction of the minute or second. So always supervise your children. Thank you.